Dermabond should do the trick. Any questions? Dr. King? Mel?
Oh, I didn't say anything.
Hey, nice of you to join us.
Hey.
Dr. Langdon!
So, Mel, can you take over a bike fall leg lack in North 2 for Langdon while he's out in triage?
You know, I can work in triage.
No,
if you
I want to
talk
keep Langdon out in triage. I don't want to keep you back here. You okay with that?
Sure.
Great.
Absolutely.
What's going on with you? You usually ride in here on your unicorn tossing wildflowers.
Unicorn?
Never mind. Is everything okay with your sister?
Oh, yeah, she's great. It's just this...
Spill, girl.
Well, a couple of months ago, I got named in a malpractice lawsuit. And so today is the deposition.
That's it?
This isn't necessarily the case here, but recent studies have linked bullying behavior to different personality disorders. On the other hand, though, I am known to be a bit overly sensitive sometimes.
Mel.
And, yes?
You're talking to yourself, kid. You need something?
She wore glasses like you, too. Weird. And what do you like to do when you're not working?
Spend some time with my sister. Read.
Do you drink coffee?
No, I avoid caffeine.
Me too. What about boba?
I love boba.
Hey, Dr. King.
Oh, it is an open dislocation.
Can you be more specific?
I think it's inferior, yeah?
Do you remember the name for that?
Sounds like a Harry Potter spell. Luxatio erecta.
Correct. Check the neurocirc.
Above the glenoid, that will convert this to an anterior dislocation and should pop right back in.
Okay.
Ready to go? 1, 2, 3. Sterile saline Dixon. Shoulder immobilizer and CT.
Guess you guys don't need me anymore.
You all right, Dr. King?
Yeah.
You don't seem all right.
Well, my deposition is today.
Do you want to talk about it?
I'm not allowed to.
No, we don't have to talk about the deposition, but we can talk about how it is affecting you. Average emergency physician catches a med-mal case every 7 years. 9 times out of 10, the doctor wins. I've been sued 4 times myself. Dr. Al?
I've never been named in a lawsuit.
But sometime.
No, what about you? What do you like to do?
You still like, the Renaissance Fair?
Really?
Yeah.
Isn't that kind of dorky, though, where everybody dresses up like somebody they're not?
Yeah, but that's the fun, you know? You can be anyone or anything you want. I actually had this alter ego that was a 17th century French woman's alter ego. Stop!
You okay, kid? It was a doozy.
Protected.
I'm on no LLC.
Okay, you need to get checked out.
I'm fine.
No choice, it's work-related. Let's find her a room and prep for a burr hole.
What? Oh. I forgot how much you like to joke. Captain Scurvy.
Who the hell's Captain Scurvy?
Fine.
That's good. Follow my finger. How's the head?
It's a little sore.
Lean forward, let me take a look. Yeah, you're gonna have a pretty good goose egg. Headache?
A little.
I can get you some Tylenol unless you need something stronger.
Oh, no, that's okay. I'm not very drug tolerant.
Lucky you.
You know, I'm glad you're back.
Thanks. Yeah, I'm glad to be back. You know why I was
See my
gone?
patient? No, not really. I mean, I heard rumors, but I learned a long time ago not to listen.
I was in rehab
Oh?
for an addiction to benzos.
Oh.
Yeah, but I'm clean now, and it never affected my work. I just need to get it all out of my system once and for all. But yeah, I didn't handle things the way I should have. I thought I could treat myself and I let a lot of people down. I'm sorry, Mel.
Attest to his injuries, his treatments, simple stuff.
Yeah, but we'll cross that bridge when we come to it, right? Mel? Rest here a minute. I'll be right back.
10 minutes, please. Doctor's orders.
ER can be a little bright and noisy.
Mel, any suggestions? Mel, you did these at the VA. How can we facilitate detumescence?
Oh,
Just stick with the facts of the case and it always goes well.
I thought you said you hadn't been sued.
I haven't, but I know many colleagues who have. I also know your work, Dr. King. Your medical decision-making in the chart is always extremely thorough. Mel, we need orders.
Right.
I got a rainbow.
CBC, CMP, UA, blood alcohol and tox.
All the above.
Cap, this young man's stable.
Little lady.
Okay, yeah, well, this makes a lot of sense now. Propranolol is a high blood pressure medication. Those are 20 milligrams each, and the starting dose is 40 mgs. How many pills did you take?
No, man, I went just before I came here.
Dad.
How many pills did you take?
Oh, I think 4, maybe 5.
That is a lot. Okay.
Got full stomach, mind you.
Well, the good news is it has a short half-life, so we need to keep you for about 4 hours to monitor, but then you'll be able to rejoin for all the late afternoon festivities.
All right.
She never flirted with you?
Sure, why?
Well, there's this guy this morning. He turned out to be a criminal, but yeah, it was a nice distraction from the deposition.
Still worried about that.
Yep. Yeah, Felicia, please. Felicia. I'm Dr. King. This is my colleague, Dr. Santos. What brings you in today?
I've had this pretty bad cough for a few days now.
Do you have anything to ask, Dr. Santos?
What?
Do you have any questions to ask our patient?
No, I'm good.
Okay, what'd you hear?
Maybe some crackles at the right base.
Okay, well, we're gonna need a chest x-ray to check your lungs.
Will that take long? Maybe I can still make it.
I was looking for you.
Well, you found me.
The x-ray came back on the lady with the cough. Weird infiltrate. Have you seen it yet?
No, I've been trying to catch up on my charting.
Right here.
Yep. Stringy right lower lobe.
Yeah, it looks like aspiration pneumonia. Think about it. How do oral and gastric fluids end up in lungs? An eating disorder.
Think she's bulimic?
I mean, she's fixated on working out. Check the enamel behind her front incisors. If it's not in the differential, it won't be in the diagnosis. You know that? Yeah, you know that. The mouth or stomach get into the breathing tube when you're choking, if you're eating or vomiting.
Oh. Do you ever drink?
It can happen if someone makes themselves vomit repeatedly. All the stomach acid dissolves the enamel.
What does that have to do with having pneumonia?
It may have caused it. Okay, so we'll need to keep you for the day for your IV antibiotics and to monitor your oxygen level.
Okay.
Okay.
What if I have been making myself vomit?
Well, bulimia is treatable. I was going to test for individual and group therapy once or twice a week. Would you be open to meeting with a therapist?
I guess.
Do you have any preference for type of therapist, male, female?
If there's a black woman, I'd like that.
Yeah, we can arrange that.
Thank you.
That was a good catch.
Black women tend to go underdiagnosed when it comes to eating disorders.
Really?
Yeah, unfortunately. You know, I thought I had an eating disorder in high school, and so I did a lot of research on the subject. I didn't. No, I just, my sister and I were really picky eaters growing up, you know? Color and texture. Being in R2, way harder than intern year.
Oh, yeah, overseeing the med students, the interns, having no time to do my own charts.
Citizens of cell block 6.
It's a deep lack through the muscle fascia. Can we get the cuffs off once he settles?
Not a chance. Orange jumpsuit, he's cuffed for a reason.
Let's go.
Stomped. Jesus.
Is that necessary?
Afraid so. Airways,
Sorry. Good on the right, too.
How are the lungs?
good breath sounds, no crepitus.
No effusion.
Pulse ox 97, BP 118/78, heart rate 112.
Tachycardia. Gentle. Dr. King, how are the chest and belly?
We have 3 anterior rib fractures and a small pulmonary contusion.
Not too bad. When do pulmonary contusions peak?
After a few hours.
And do we always admit for a 3-rib fracture?
In the elderly, yes, but not if a patient can manage the pain and doesn't need supplemental oxygen.
Good.
Okay, he's really hurting here. You think you could set us up with a...
Do you need to get that?
Nope, it's my mom.
See the fluid dissect and diffuse.
Dr. Mohan, we need you.
Nice job on the sub-Qs. Really took the tension off the wound.
Thanks.
I can help with the skin layer. 4 hands are faster than 2.
Whoa. That just tore right through the skin.
May need to take bigger bites farther away from the wound edges.
Yeah. Skin seems pretty fragile. Dr. MacGyver work here? I don't know.
How's it looking?
Good. The stair strips did the trick.
CT is ready.
Where had you scanned him?
Head and neck want thin cuts and a 3D reconstruction of the mandible before they decide if Mr. Varney needs surgery.
Have they even come down to examine him in person?
No, they must be backed up.
Or there's a July 4th sale at the BMW dealership.
Labs are back. Albumin's low, total protein's low. He also has megaloblastic anemia.
Malnutrition.
Probably jail quick. Prison infirmaries tend to be short-staffed, so we need to be thorough. What's in the differential diagnosis for malnutrition?
Inadequate intake, methamphetamine use, severe alcoholism, ADHD medication.
What else?
Cancer of the oropharynx, esophageal stricture.
Could be an intentional hunger strike.
Or refusing food to get to the infirmary.
Could also be abuse or neglect. Let's start with a nutrition history.
If he's clear to eat.
As long as it's a liquid diet.
We have the results of your CT scan.
Your jaw should heal without surgery, which is good news, but it will be a few weeks.
Before I can eat?
Solid foods, yes. Or you can have food pureed with liquid in a blender.
I don't have a blender.
Right. Sorry.
We have a calorie-rich supplement drink called Ensure. Comes in chocolate, vanilla, or strawberry.
Chocolate, please.
Okay. How often do you eat cereals, fruits, or vegetables?
Not many fruits and vegetables in prison.
Slow and steady. What year is your CT show?
Moderate pulmonary contusion, 3 rib fractures, no intra-abdominal bleeding, and oblique fracture in the body of the mandible anterior to the angle.
All favorable for healing. What's the treatment plan?
A pain medication, antibiotics, liquid diet, pulse ox a few times a day, and then also dressing changes for the laceration.
Which he can get at his correctional facility.
Or he stays here for a few days and we get him on the right track.